Chronic Obstructive Pulmonary Disease, or COPD, is a long-term lung condition that makes breathing difficult. It includes diseases like emphysema and chronic bronchitis. COPD is a progressive illness, meaning it gets worse over time, but the good news is that many risk factors can be managed or avoided. In this video, we'll explore practical steps you can take to lower your risk of developing COPD, focusing on lifestyle changes, environmental factors, and early interventions. Let's begin by understanding what puts you at risk and how you can take control of your lung health. COPD risk factors include smoking, exposure to air pollutants, genetic predisposition, and respiratory infections. Smoking is by far the most significant risk factor, but workplace exposures and environmental pollution also play a role. Understanding these risks is the first step toward prevention. By identifying which factors you can control, you can make informed decisions to protect your lung health. Next, we'll discuss the most important step you can take to lower your risk: quitting smoking. Quitting smoking is the single most effective way to reduce your risk of developing COPD. Cigarette smoke damages the airways and lung tissue, leading to chronic inflammation and narrowing of the air passages. Even if you've smoked for years, stopping now can slow the progression of lung damage and improve your overall health. There are many resources available, from counseling to nicotine replacement therapies, to help you quit. Remember, it's never too late to make a positive change for your lungs. Secondhand smoke contains many of the same harmful chemicals as directly inhaled smoke. Regular exposure, whether at home, work, or public spaces, increases your risk of developing COPD. Protect yourself and your loved ones by creating smoke-free environments. Encourage friends and family to smoke outside, and avoid places where smoking is allowed indoors. Every step you take to reduce exposure helps safeguard your lung health. Air pollution, both indoors and outdoors, can irritate and damage your lungs over time. Common sources include vehicle exhaust, industrial emissions, and even household products like cleaning agents and paints. To lower your risk, stay indoors on high pollution days, use air purifiers, and ensure good ventilation in your home. When using strong chemicals, wear a mask and open windows. These small changes can make a big difference in protecting your lungs from harmful pollutants. Certain jobs expose workers to dust, fumes, and chemicals that can increase the risk of COPD. Construction, mining, and manufacturing are common examples. If you work in such environments, always use protective equipment like masks and follow safety guidelines. Employers should provide proper ventilation and training on handling hazardous materials. By prioritizing workplace safety, you can significantly reduce your risk of lung damage and COPD. Indoor air quality is just as important as outdoor air. Common indoor pollutants include tobacco, smoke, dust, mold, and fumes from household products. To minimize these risks, keep your home clean, use exhaust fans, and avoid smoking indoors. Regularly check for mold and fix leaks promptly. Using natural cleaning products and ensuring good airflow can further reduce your exposure to harmful substances. While most COPD cases are linked to environmental factors, genetics can also play a role. A rare inherited condition called alpha-1 antitrypsin deficiency increases the risk of COPD, even in non-smokers. If you have a family history of lung disease, discuss genetic testing with your doctor. Early detection allows for better management and preventive strategies tailored to your needs. Frequent respiratory infections, especially in childhood, can increase the risk of developing COPD later in life. To reduce this risk, practice good hygiene. Wash your hands regularly and avoid close contact with people who are sick. Vaccinations, such as the flu shot and pneumococcal vaccine, are important preventive measures. Keeping your immune system strong helps protect your lungs from infections that could cause long-term damage. A balanced diet rich in fruits, vegetables, and whole grains supports overall health, including your lungs. Antioxidants found in many plant foods help protect lung tissue from damage caused by pollutants and inflammation. Staying hydrated also keeps your airways moist and functioning well. By making healthy food choices, you provide your body with the nutrients it needs to maintain strong, resilient lungs. Regular physical activity strengthens your respiratory muscles and improves lung capacity. Activities like walking, swimming, or cycling can help keep your lungs healthy and efficient. Exercise also boosts your immune system and helps maintain a healthy weight, both of which are important for reducing COPD risk. Aim for at least 30 minutes of moderate activity most days of the week. Being overweight or underweight can both negatively affect lung function. Excess weight puts pressure on your lungs and makes breathing harder, while being underweight can weaken your respiratory muscles. Maintaining a healthy weight through balanced nutrition and regular exercise supports optimal lung health and reduces your risk of COPD. Chronic diseases like asthma, diabetes, and heart disease can increase your risk of developing COPD. Managing these conditions with regular medical care, medication, and healthy lifestyle choices is essential. By keeping other health issues under control, you reduce the strain on your lungs and lower your overall risk. Routine checkups with your healthcare provider can help detect early signs of lung problems. Early intervention is key to preventing COPD or slowing its progression. If you have risk factors, such as a history of smoking or exposure to pollutants, discuss lung function tests with your doctor. Timely medical advice and monitoring can make a significant difference in your long-term lung health. Early symptoms of COPD include persistent cough, shortness of breath, and frequent respiratory infections. Recognizing these signs and seeking medical attention promptly can lead to earlier diagnosis and better outcomes. Don't ignore changes in your breathing or chronic cough, especially if you have risk factors for COPD. If your job exposes you to dust, fumes, or chemicals, take steps to minimize your risk. Use protective masks, follow safety protocols, and ensure proper ventilation in your workspace. Report unsafe conditions to your employer and participate in workplace health programs. Protecting yourself at work is an important part of lowering your COPD risk. Good ventilation helps remove indoor pollutants and keeps the air in your home fresh. Open windows regularly. Use exhaust fans in kitchens and bathrooms, and consider using air purifiers. These steps help reduce the buildup of dust, mold, and fumes, all of which can contribute to lung irritation and increase COPD risk. Many household cleaning products release fumes that can irritate your lungs. Switching to natural or fragrance-free products can help reduce your exposure to harmful chemicals. Always use cleaning products in well-ventilated areas, and wear gloves or masks if needed. These simple changes can make your home safer for your lungs. Stay informed about air quality in your area, especially if you live in a city or near industrial sites. Many weather apps and websites provide real-time air quality updates. On days when pollution levels are high, limit outdoor activities and keep windows closed. Monitoring air quality helps you make smart decisions to protect your lungs. Burning wood, coal, or other fuels indoors releases smoke and harmful particles that can damage your lungs. Use electric or gas heating instead of open fires or wood stoves whenever possible. If you must use a fireplace, ensure proper ventilation and keep it well maintained. Reducing indoor smoke is a key step in lowering COPD risk. Children's lungs are more sensitive to pollutants and smoke. Protect them by keeping your home smoke-free, using safe cleaning products, and ensuring good ventilation. Encourage outdoor play in clean air environments and keep them away from areas with heavy traffic or industrial pollution. Early protection helps set the foundation for lifelong lung health. Vaccinations protect against respiratory infections that can damage your lungs and increase COPD risk. Annual flu shots and the pneumococcal vaccine are especially important for people with risk factors. Talk to your healthcare provider about which vaccines are right for you and your family. Staying up to date with vaccinations is a simple but powerful way to protect your lungs. Exercising outdoors is great for your health, but on days with poor air quality, it can do more harm than good. Check local air quality reports before heading outside, and choose indoor activities when pollution levels are high. This simple habit helps you stay active while protecting your lungs from harmful pollutants. Some professions carry a higher risk of COPD due to exposure to dust, fumes, or chemicals. If you work in construction, mining, or manufacturing, be proactive about your lung health. Use protective equipment, participate in health screenings, and advocate for safer workplace practices. Awareness and action can help you stay healthy on the job. Dust particles can irritate your lungs and contribute to COPD risk. Whether at home or work, minimize dust by cleaning regularly, using air filters, and wearing masks when necessary. If you're doing renovations or cleaning dusty areas, take extra precautions to protect your lungs from harmful particles. Aerosol sprays, such as air fresheners and hairsprays, release fine particles that can be inhaled deep into your lungs. Limit their use, choose pump sprays or solid alternatives, and always use them in well-ventilated areas. Reducing aerosol exposure is another step toward healthier lungs. Strong fragrances from perfumes, cleaning products, or air fresheners can trigger respiratory irritation. Choose fragrance-free or hypoallergenic products whenever possible. If you notice that certain scents make you cough or feel short of breath, avoid them to protect your lung health. Drinking enough water helps keep your airways moist and supports the natural cleaning process of your lungs. Proper hydration can also thin mucus, making it easier to clear from your airways. Aim to drink water throughout the day, especially if you're active or in dry environments. Cold air can trigger bronchospasm and make breathing more difficult, especially for those with sensitive lungs. On cold days, cover your mouth and nose with a scarf when going outside, and avoid strenuous outdoor activity. Keeping your airways warm and moist helps prevent irritation and reduces COPD risk. Allergies can cause inflammation in your airways and increase your risk of respiratory problems. Manage allergies with appropriate medications, avoid known triggers, and keep your living space clean. Reducing allergy symptoms helps protect your lungs and lowers your risk of developing COPD. While vaping and e-cigarettes are often marketed as safer alternatives to smoking, they still expose your lungs to harmful chemicals. The long-term effects are not fully understood, but early evidence suggests they may increase the risk of lung disease, including COPD. The safest choice is to avoid all forms of smoking and inhaled substances. Raising awareness about COPD risk factors among your family members can help everyone make healthier choices. Discuss the dangers of smoking, the importance of clean air, and ways to reduce exposure to pollutants. Family support makes it easier to adopt and maintain healthy habits for better lung health. A family history of COPD or lung disease can increase your risk. Talk to your relatives about any history of respiratory illnesses and share this information with your healthcare provider. Knowing your family history helps you and your doctor make informed decisions about screening and prevention. Good hygiene habits, such as frequent hand washing and covering your mouth when coughing or sneezing, help prevent the spread of respiratory infections. These simple practices protect not only you, but also those around you, reducing the overall risk of infections that can lead to COPD. If you notice persistent cough, wheezing, or shortness of breath, don't wait to seek medical advice. Early diagnosis and treatment can prevent further lung damage and improve your quality of life. Your healthcare provider can recommend tests and interventions tailored to your risk factors. Some medications, especially those that suppress the immune system, can increase your risk of infections and lung problems. Always discuss the risks and benefits of your medications with your doctor, and never stop or change your medication without medical advice. Being informed helps you balance treatment needs with lung health. In some regions, burning wood, crop waste, or animal dung for cooking or heating is common. This biomass smoke contains harmful particles that can damage your lungs. Use cleaner fuels, improve ventilation, and avoid indoor fires whenever possible to reduce your COPD risk. Community efforts to reduce air pollution benefit everyone's lung health. Support policies and programs that promote clean air, such as reducing vehicle emissions and encouraging green spaces. By getting involved, you help create a healthier environment for yourself and future generations. Wearing masks in dusty or polluted environments can help filter out harmful particles and protect your lungs. Choose masks designed for respiratory protection, especially if you work in high-risk jobs or live in areas with frequent air pollution. Proper use of masks is a simple but effective way to lower your COPD risk. Knowledge is power when it comes to preventing COPD. Stay updated on new research, guidelines, and recommendations from trusted health sources. The more you know, the better equipped you are to make healthy choices and reduce your risk. Supporting smoke-free policies in public places, workplaces, and homes helps reduce everyone's exposure to tobacco smoke. Advocate for these policies in your community and workplace to create healthier environments for all. Health screenings, such as lung function tests, can detect early signs of COPD before symptoms appear. If you have risk factors, ask your doctor about regular screenings. Early detection allows for timely intervention and better long-term outcomes. Workplaces that prioritize air quality and employee health help reduce COPD risk. Encourage your employer to invest in proper ventilation, provide protective equipment, and offer health education programs. A healthy work environment benefits everyone and supports long-term lung health. Making lifestyle changes to lower your COPD risk can be challenging, but staying positive and motivated is key. Set realistic goals, celebrate your progress, and seek support from friends, family, or support groups. Every step you take brings you closer to better lung health and a higher quality of life. Lowering your risk for COPD involves a combination of lifestyle changes, environmental awareness, and proactive healthcare. By quitting smoking, avoiding pollutants, maintaining a healthy lifestyle, and staying informed, you can protect your lungs and enjoy better health for years to come. Remember, every positive change counts, and it's never too late to start caring for your lungs.